There is. We have one person with A. Let's see. Whoops. The answer is A, bats and skunks. And so only mammals can carry rabies. And so bats and skunks are the main sources of rabies in Colorado. Other mammals can be infected with rabies from bats and skunks, and domestic animals such as dogs, cats, cattle, and horses can be infected by being bitten by a rabid wild animal. And Ning will go into more of that later. And your second and last pop quiz question is, which of the following are prohibited in child care facilities, including the staff restrooms and staff-only areas? So do you think it's A, incense, B, toilet urinal deodorizer blocks, C, chemical air fresheners, and D, scent-enhanced products such as candles, essential oils, and spray and plug-in air fresheners, etc.? Or E, all of the above? Okay, Susan, thank you, Susan, has said E. Any other guesses? Another E. Thank you, Tori. And the answer is E, all of the above. And the reason I put this in is because I have been doing some health inspections with Kara, and interestingly enough, there will not be any air fresheners in the children bathrooms, but in the staff bathrooms, we keep finding chemical air fresheners and some of the sprays, and those are not allowed in the staff restroom and staff-only areas as well. So to get rid of bad odors, the goal is to do it through cleaning and ventilation, because you never know how those odors will spread throughout the facility and how it will affect children's lungs and allergies. Okay, and if you're wondering, this is from CDPHE, the regulations on page 10. So who answers? So this is our health ECE partner meeting, and so I'm Martha Hensa, and Ning Cheng works with me, and we as the outbreak epidemiologist. And whenever you write to healthece@bouldercounty.gov, it's either myself or Ning who will answer your health and outbreak questions. Today, we'll be talking about, since this is our quarterly meeting, so we're talking about how can you prep for summer. We'll also have Elise Barr-Tatum from licensing talk about, we have a lot of questions regarding insect repellent and sunscreen. So she'll be able to answer all those licensing questions. And then Ning will talk about some communicable disease updates, wild animals and rabies, West Nile virus, pertussis. Maybe you've been hearing about that in the news recently, as well as measles. And then we'll have a special guest speaker, Laura Johnson, who did her internship at Boulder County Public Health. And I think you'll be really happy to see the results of her Family Voice Ambassador Focus Group. We just appreciate you all so much and feel like you should really know the results of who is the go-to person when parents have questions about developmental delays or children with developmental delays. And then you'll have to bring out your calendars for a summary and future meetings. Okay, to begin with, as we prep for summer, what are some things that you do for field trips? And you can put that in the chat or come off mute here. Do you ever picnic in the park? Thank you, Susan. Maybe go to the park. I think some people walk to the library, going to some of the gardens. So lots of different things when you go on field trips. But the goal is, it's important that as you go on field trips, just because you're out and about doesn't mean you should throw away the concept of hand washing and hand sanitizer. I work with an intern from Fairview High School. She's only 16 and interested in going into public health. And I asked her when she was in childcare for the summer, what did her childcare do to help prevent the spread of disease? And she said, well, we'd go to parks and often there was water in the bathroom, but there wasn't soap or paper towels. And so she said her childcare would always bring soap and paper towels to make sure that they could wash their hands, even when out and about, especially before eating. And so the best soap and towels. However, if there's no running water, such as if you take your children on a hike or a walk, then you can use a hand sanitizer. But note, the hand sanitizer is not effective against norovirus, which is that virus which causes diarrhea and vomiting. Then in the summer, children are hot and want to be outdoors, and you want to help keep them cooled down. And so we recommend, if you choose to do water play, to do sprinklers or misters, water balloons, squirters, slip and slides, and even try a public pool. If you choose to do a portable wading pool, just remember that they cannot be used by diapered children. They must be empty and disinfected after use by each group of children. They must be emptied and disinfected at the end of each day and to place in storage when they're not in use. So the goal is that we don't have any standing water. Wading pools can just be a breeding ground for mosquitoes and any communicable diseases. And then maybe you want to take your children to the creek. The Boulder Creek is beautiful, or a lake or a river. But just some things to keep in mind when you go on these field trips are try not to get water in mouth, eyes, or any open wounds. It's especially important to wash hands after being in the creek. This can really help prevent the spread of waterborne diseases such as Shigella. And be aware that small children and older adults can have a greater risk of contracting serious illness from waterborne pathogens. And there are water quality standards for E. coli in recreational water bodies, and this includes the Boulder Creek. And the state water quality standard is 126 colony forming units per milliliter in Boulder Creek, and sometimes Boulder Creek exceeds this standards. The levels of E. coli in the creek can fluctuate frequently, so just to keep that in mind as well. And then the last thing, when you're out and about, just to think about, what are you going to do if you have a sick child? Do you have enough staff so one person could walk the sick child back or even carry the sick child, as you can see in the picture? Did you bring enough water along on your field trip? And thinking about, if you did take a bus or a van to the field trip, how could you isolate that child? Could you put them in the middle or the front or the back of the bus to distance them from other children? And sometimes when it seems like children are ill, maybe it's not actually illness at all, but exhaustion, nerves, or dehydration. If you happen to see an increased trend in illness, just remember to notify Health ECE at bouldercounty.gov. And then one question which I receive a lot through the Health ECE Index is, especially if the weather is smoky, can we play outside? So as a health inspection regulator, we don't regulate, there's no health regulation that covers air quality, so we don't regulate it. And I generally go to resources provided by Colorado Department of Public Health and the Environment. And there's two links there. The top one is the Air Quality Advisor, and that's a broader range of air quality for the whole Front Range and the Denver metro area. I like to use the local air quality. So if you just type in www.airnow.gov, you can even type in the zip code of where your ECE facility is and see if it's recommended to play outside or not. And now I just saw, so that's a little bit about prepping for summer. And now I just saw that Elise Bar Tatum, who's a lead licensing specialist from it's called DELA, Division of Early Learning Licensing and Administration, is here to answer questions and to present about repellent and sunscreen. So thank you so much for coming, Elise. I'll turn it over to you.
All right, thank you very much. Yes, as stated, thank you, Martha. As stated, I am one of the lead licensing specialists within the Boulder area. And I have just a few slides to share with you in regards to sunscreen. There's more information that we have on sunscreen. I have a very little bit about topicals and insect repellents, but a little bit more on the sun protection for you today. And I'm going to share my screen, but in order to do that, let me see. I might have to stay in unfortunately, I wanted to do it in the slideshow format, but I might not be able to do that. Let's see. Okay, so I see that there's already, I'm just kind of overtake your sharing screen, Martha. Okay. Let's see. So I'll do that. I'm not as familiar with the Microsoft Teams and the process on that. So my apologies. It's not letting me scroll down. Okay, here we go. All right. Okay, so I think hopefully you can see my full screen.
Perfect.
Here.
Perfect.
Okay,
we can see the full screen.
Awesome. Okay, so again, with the Colorado Department of Early Childhood, DELA, Division of Early Learning Licensing Administration. So again, this is information on sunscreen and our topicals requirements. So this is really relevant to all child care programs. So it will be the child care centers, family child care homes, school age programs, and the day and camps. So this is really the same rules are applicable to all of the programs. And then just some younger requirements for the youngers, and obviously that's probably more for the child care centers and maybe the family child care homes, but all applicable. So for topicals, I'm just going straight out of most of this is out of our rule book or our regulations, but in regards to the one specifically in 2.220K, this is our child care center rules, and it will say the same thing in all of the rules, but for topical preparations such as the petroleum jelly, diaper rash, ointment, sunscreen, insect repellent, and other ointments, they may be administered to children with written authorization from the parent. So you do not need, for insect repellent or any of these topical creams, you do not need doctor's authorization or a healthcare plan for that. You will, however, if you need to apply any of these topicals to an open wound, that's when you would need to get a prescribing health provider involved in the process. Again, so in relevance to the 2.221 under sun protection, that again, you do need that written authorization for applying that to children, and then instructions from the parent or guardian for the application of it. And then you need to make sure that it's approved sun protection with full spectrum of the ultraviolet A and ultraviolet B, so UVA and UVBs, and a rating of sun protection factor of SPA 30 or greater, and for any areas that are exposed on the children. And this does need to be applied year round. It's not just when it's summertime or anything like that, as you know. And then again, a doctor's permission is not needed to use sunscreen at a program. So as in regards to the sunscreen protection for programs or centers or any child care program, you must apply the sunscreen or have the parent or guardian apply the sunscreen, or another form of sun protection can be used, but it needs to be done prior to the children going outside. So when the sunscreen is applied by the parents, you must have or the program must have a mechanism that is able to document the application time. If they do not have, if you do not have that mechanism in place, that's okay. You just want to make sure that you apply the sunscreen 30 minutes prior to the children going outside. And then thereafter that, you want to make sure to apply the sunscreen if they're outside for more than 1 hour. Thereafter that, the sunscreen needs to be reapplied every 2 hours or as directed by the product label. And so when you apply the sunscreen, you want to make sure, any children that bring sunscreen to the program, you want to make sure that the sunscreen bottle has the child's first and last name written on it, not first name, last initial. It needs to be the full first name and last name on the bottle. That same goes, it's the same thing with any other, not just sunscreen, any other ointments, diaper creams, the insect repellent, anything like that, it actually needs to have the first and last name written on it. And obviously we don't apply that sunscreen or anything like that to children that are under 6 months. I think that's actually on the next screen, but yeah, so I'll just go to that one when it's on the next screen. I thought this was on this slide. And then, it's in relevance to this slide as well. You want to make sure that if the sunscreen is being provided by the program, is that parents are given advance notice of the sunscreen and in writing, and then what type of sunscreen that is being used at the program. So obviously it still requires that authorization, but parents need to be notified of the type of sunscreen that's being used. And then going on to the part I was going over, kind of jumping ahead and going to, is that children that are 4 years of age and over can apply sunscreen to themselves under the direct supervision of staff. So always make sure that staff are supervising sunscreen application for the children. And then any children that are under 6 months of age cannot have that. And so you just need to make sure that they're out of direct sunlight while outdoors. And so that is it as far as what I have for licensing requirements for sunscreens, and of course the very short information about the insect repellents. If anyone has any questions, I open it up for questions.
Thank you so much, Elise. I learned a lot too. Thank you.
Wonderful.
We do have one question in the chat, and Susan asked, if we go out early, like 9 to 10, is sunscreen necessary?
Yep. Sunscreen is required at any time of the day. The sun is still out at that time. And obviously I wouldn't, you guys don't gonna provide care when it's dark outside, but the sun is out and you should be applying it, or they should be applying it in the mornings as well.
Perfect. Thank you so much, Elise. Any other questions about sunscreen or insect repellent?
For the insect repellent, does it matter if it has DEET or not?
We don't have any specifics on the actual type, as long as you are clear that parents are giving authorization for the insect repellent, written authorization for the insect repellent. We don't have any specifications for the type of insect repellent.
Good question, Lori. Thank you, Elise.
Yes.
And then another question in the chat, if we provide 2 types of sunscreen, this is from Amy, one mineral-based and one not, do we label each bottle with all names?
If you're referring to one child bringing their own sunscreen and a child has 2 sunscreens at the center, one is mineral based and one is not, absolutely. Anything that a child brings that's topical that is being applied to their bodies or their skin should be labeled with the child's first and last name. If it's the center's then I always like to tell programs to, label on that bottle that it's the center's, because sometimes kids, have a center one, but the parents won't necessarily want you to use theirs. They're that one and they want you to use theirs. And so, I like for programs to have written on the centers that it's labeled that it's the centers. And then of course the children's are labeled individually for each child, and however many they have, each one is labeled.
Okay, and I think along those lines, she's also asking for the bug spray. So we as a center, it sounds like, offer one with DEET and one without. And then on the label, does the center need to list every name that uses the center's bug spray and sunscreen? Or could they just have an overall center approved? Or
yeah, I would say that it's similar to the sunscreen. That if you guys have a center-based one that you guys use for the children, as long as you have the written authorization for the sunscreen, or excuse me, the insect repellent, that should be fine to use. Because I don't know, if you could let me jot that question down, just because we don't necessarily have any information about, and I can't say that I've actually seen a program have their own ointment or own like diaper cream for a child. I feel like each parent has their own and provides it for their child. I can't think of a program that actually provides one for everyone. And then, but I would say for sure that still needs written parent authorization. And I would have a form similar to what you have for a sunscreen form, that, you leave a blank for whatever the parent's name is, and allowing permission for ABC Center to apply sunscreen to my child and child's name, and then have the parent sign off on that. Same thing with the insect repellent, but I want to double check and make sure that I think you can, but I want to double check and make sure that you can use insect repellent as a program in, overall for all the children.
Okay, yeah, because she was wondering about the sunscreen and the bug spray.
Yeah, sunscreen for sure you can, because it states it in rule. But as far as for a program using their center-based insect repellent for all of the children, I want to say yes, as long as you have that written authorization. But I want to be clear and make sure and get that verified.
Okay, that would be wonderful. And you can send the answer to me, and then I'll send it to Jane, my boss, who will send it out to everyone on the call today, as well as the ECEs that aren't on the call today. And then the last question is, or no, there's another question. And aerosols are not prohibited, correct?
Aerosols, like aerosol sunscreen?
And I think bug spray too. So they are.
No, we do not have anything in rule that says that they're prohibited.
Okay, so aerosols are allowed, basically.
Yeah, there's nothing in rule that says aerosols are prohibited.
Okay. And then another one, parents should be authorizing the brand of topical used so they can verify the ingredients, including sunscreen, bug spray.
Say that again?
I don't know if should parents be authorizing the brand of topical used so they can verify the ingredients, including sunscreen and bug spray?
So I think that's getting a little specific. I don't think that, again, we just have very general basic rules. Parent written authorization for the sunscreen, as far as if you want to get ingredients and you want to get specific about the ingredients, and parents are asking for ingredients. If you're providing a sunscreen or a product topical and they're asking for this general ingredients for it, by all means, provide that information to them. I think you should be open about it if they are asking about it. But yeah, and it looks like Shannon is on the call And
Okay.
Shannon, you want to step in? You could say something. You post something. I'm not pulling it up. So if you don't, you can go ahead and say whatever it is.
You know what? That was my
Can you all
mistake.
hear
I
me?
didn't
Oh, okay.
see I didn't see who wrote the question, so I apologize. Shannon was answering another one. So I'll just only ask the ones that Shannon hasn't answered.
Oh, okay.
Can you hear me
Sorry.
okay? Or is my mic not working?
Go ahead, Shannon.
You guys can hear me? Awesome.
Yes.
Sorry to jump in.
Oh, please.
And I said should. So best practice, of course, is yes, if you are providing any kind of topical, again, doctor's permission is not required for topicals when they're used as a preventative. If it's something that's ever used as a treatment, that's when you do need the doctor and the parent to authorize the topical. But if you're providing sunscreen or bug spray with DEET, I would say best practice is definitely on that authorization form. This is the kind of bug spray we provide. Do you want us to use ours, or are you going to provide your own with their first and last name labeled? I think it's in one of our admin guides potentially that we did start to get specific with the brand. Initially, it wasn't that we wanted to be so specific with the brand, but my understanding is yes, we do want that noted so that parents are authorizing, yes, you know, copper tone 50 is perfect for my kiddo versus like we have a 50 plus SPF sunscreen available. That way, if they
Yeah,
did
thank you.
have, reactions, they can know ahead of time, but they need to bring.
Thank
them.
you. I was trying to look up, but I ran out of time before I went. I wanted to make sure I got on the call on time, but I wanted to also make sure I look up the admin guide. And you guys are definitely welcome to look up that admin guide and any clarifications on those rules. But it does not state it in rule that that is required to have the brand. It sounds like it's best practice, but if it is clarification within the admin guide, by all means, we definitely need to put that, but we can verify that if it's in the admin guide or not. But yeah.
It notes type of sunscreen, and so when I had verified that once upon a time, the type / brand is what we're looking for. We're not just looking for like a type like 30 plus. We want to know what type of 30 plus sunscreen is being used. And I did just copy that rule in the chat, but I mean, I think we're all together when we see that these rules and practices frequently change. I mean, they've changed so drastically over 5, 10, 20 years that I think it's a lot that we do have to ask ourselves, wait, what is it now? So that is just, again, my understanding, and we can definitely loop back around to make sure that that is clarified because I don't want to be providing misinformation to the group either.
It looks like, I don't know if, was that you that, whatever. If that's what's in the rule, then by all means, absolutely. Then we need to do that. I might have missed that question. I wasn't understanding the ingredients question in general, but yes, so I didn't answer that question fully. So thank you, Shannon, for answering that question.
That was super helpful. Thank you, Shannon, for popping in, and thank you, Elise. And I think we have lots of answers in the chat as well. And so we'll go from there. Thank you so much for presenting.
Yes, thank you.
Okay.
All right, stop sharing.
Okay. So we'll hop back here. If you can see my screen, okay? And okay, so the key is with written parental permission. Okay, so I know Laura is on the talk as well, and Ning will be presenting as well. If I can ask them real quick, Laura, do you want to hop on next? I know you're in the middle of grant writing.
Yes, I would be happy to go next, if that's okay.
Okay, wonderful. So we welcome here Laura Johnson, who will give us a presentation and a thank you to all of you. So take it away, Laura.
Thanks, although I'm seeing this communicable disease in the outdoors, and I might just stay and listen in for that because that sounds interesting.
Yeah, perfect. And I didn't, I think you can just share your screen. Oh, perfect.
Can you see?
Yes, perfect. I can
Okay,
see it.
great.
Thank you.
Okay, Perfect. Well, hi everyone. My name is Laura Johnson. I have been serving kind of dual roles over the last 8 months. One, I work for Colorado Community Health Alliance, which is the Medicaid regional accountable entity for Boulder County. So we serve Boulder County Medicaid residents along with 7 other counties along the Front Range. I'm also a Master's of Nursing student that has been working with Boulder County Public Health, Family Health Division over the last 8 months. I just finished up a few weeks ago, and one of my final projects was on developmental screening, specifically for Spanish-speaking families. And Martha invited me to come share some of those results with you. I know a few of you maybe have already heard this information, and for some of you, it will be new. So I'll just go ahead and dive right in. You can stop me at any time if you have questions. I'll also take questions at the end. But thanks for your time. Okay, let's see. So I'll give you just a quick overview of this presentation and what we did for this project. So again, I'm an MSN student with the University of North Carolina, have been collaborating on this project with Boulder County Public Health. And the intent of this focus group that was conducted, I'll go into more details about that, was to assess the effectiveness of Boulder County's Assuring Better Childhood Development, the ABCD Partnerships Referral Toolkit, through the lens of mono and bilingual Spanish-speaking families. We conducted focus groups with permission for this project, and I will do an overview of that focus group feedback. Before we get to the focus group feedback, just going to quickly dive into kind of the problem and identification of disparities for children 0 to 5 with developmental delays and disabilities. So here's a timeline. Children are inadequately screened for developmental delays and disabilities. So ideally, as you all know, children would be screened between that 0 to 5 age range on a regular basis at well child visits in an ideal world for developmental delays and disabilities. In 2001, the American Academy of Pediatrics began recommending universal developmental screening. In 2006, those recommendations were expanded to include more formal guidelines and algorithms of who, how, and when to screen. And then between 1997 and 2017, likely as a result of increased screening recommendations, diagnoses of developmental delays and disabilities increased by 38.4%, increasing from around 12% in 1997 to 18% in 2017. In 2020-2021, Healthy People 2030 reported that almost 35% of kids under the age of 35 months received a developmental screen, and 10% of those who were screened received an intervention. In 2021 and 2022, you can see that Imagine Colorado served 396 Boulder County residents in their early intervention program. And then for the Colorado data, almost 50% of children are screened for developmental delay between 0 and 5 years of age. However, only 5% of those receive an intervention. So you can see that the intervention rate for Colorado is lower than the national rate of 10%. And ideally, that intervention rate would more closely match the 18% of kiddos who have a developmental delay or disability. So why does that matter? Children with developmental delays and disabilities are vulnerable. They're 2 to 7 times more likely to need a prescription medication, utilize mental health services, need speech, occupational, or physical therapies. They're 18 times more likely to need special education. They're more likely to see a specialist and need home health. And as we know, early identification of delays and disabilities can help resolve delays altogether or reduce worsening symptoms and improve quality of care. So when we look at health disparities among children with developmental delays, the War on Poverty in the 1960s really brought awareness that children in poverty were more likely to have a developmental delay than those kids who are not in poverty. Head Start was one of the programs that came out of the War on Poverty and was really intended to address this concern. We know that the data on adverse childhood experiences as well as social determinants of health over the last several years have shown us that in addition to medical diagnoses, the abuse, poor nutrition, environmental toxins, food, stable housing, transportation, and all of the access to basic resources are more impactful on health than physical conditions alone, and those in poverty are more likely to experience adverse childhood experiences and have social determinants of health needs. So there's actually a lot of data around health disparities among those who have a developmental delay or disability. However, kind of a landmark study from 2006 to 2008 was a prospective longitudinal study that looked at almost 8,000 children in preschool and kindergarten. And just a few tidbits of the results. Black, Asian, and those who spoke a language other than English were less likely to receive a diagnosis of developmental delay. Black children had the lowest adjusted odds ratio of being diagnosed. Black and Latinx children were less likely to receive intervention or special education. And then non-Hispanic white, those who are male, and those less than 100% of the federal poverty level were the most likely to receive diagnosis and intervention. So that's meaningful when we consider Spanish-speaking families and their experience in this focus group. You can see that from this study that those who speak another language than English are less likely to receive a diagnosis of developmental delay, and this information has been replicated in multiple other studies as well. So let's talk about the process and the key findings from the focus group. Here's just kind of an overview of what we did. So the question we identified for the focus group is the ABCD referral toolkit relevant and helpful for monolingual and bilingual Spanish-speaking families? Our evaluation method was focus groups. The participants in the focus groups were the Family Voice Ambassadors community group. We took time to translate the entire ABCD partnership toolkit into Spanish. Only certain sections are currently in Spanish. The patient member facing sections are in Spanish, but we translated the entire toolkit so they could review all of the pieces of it. And then we created focus group questions. So the questions that were asked is one, what's the overall feedback on the ABCD partnership referral toolkit? What's been your personal experience with connecting to developmental evaluations? We really wanted to understand their barriers and what made them decide to take their child to an evaluation or not take their child to an evaluation. We also wanted to understand how they would like for someone to communicate with them. The ABCD Partnership Referral Toolkit is really intended to be used to educate professionals on how to communicate with families and how to navigate developmental screenings and referrals. And so we wanted to know if the language and the way the toolkit was set up is helpful. What would you like to have someone say to you? What would you not want for someone to say to you? And if there were any cultural considerations that we should know about. So who participated? And I forgot to update this slide, Martha. Martha gave me very good feedback on this slide with putting the total number of participants, and I forgot to do that. But we had 14 total participants. 8 of those were monolingual Spanish speaking. 3 of those were monolingual English speaking. 2 were bilingual English Spanish, and 1 was bilingual English Russian. So you can see that about 70% of the participants were either bilingual or monolingual Spanish speaking. So what did we learn? I really went into this focus group having very open hands, not knowing what to expect or what these families would say. And the information that we received was very enlightening and helpful for how to make adjustments to our systems to better support families. So, one, developmental screenings are not consistently performed according to the families we interviewed in the focus groups. Results and how to access referrals for developmental evaluations are not clear. Doctors and providers are not consistently a trusted source of information when it comes to developmental screenings and referrals for further evaluation. Wait times for referrals are unexpectedly long. Language lines do not accurately translate information shared with families. And early child care providers and schools are strong advocates for developmental concerns and are considered to be a trusted resource in the community when families have concerns about their child's development. So way to go, all of you. Here's a few more details regarding the family's feedback. One is when a family is referred to Childfinder Early Intervention or some other resource for further developmental evaluation, oftentimes the referral information is unclear. The reason for the referral is not explained well, and that results in parent hesitation to take the child to the evaluation. Parents unanimously, if they were Latina or bilingual Spanish speaking or monolingual Spanish speaking, those participants unanimously felt dismissed, that their concerns were not valid and that their child's doctors or providers were not strong advocates for their children. Participants felt judged for having concerns about their child's development by their child's doctor or provider. Several parents were unclear if their child had ever had a developmental screening at a well check, and some reported that their child has never been screened by their doctor. Again, language lines often use inaccurate translations due to differences in dialects, causing a lot of confusion about diagnoses, referrals, and next steps. And again, preschools and schools are strong advocates. The families were so clear about this, that this is really who they go to when they have concerns about their child's development, that this is really a trusted resource for them and someone who they depend on for information. So in regards to how to communicate with the families had strong opinions about how they would like for professionals to communicate with them. One, they want for their opinions to be valued as being the experts of their children, right? Who knows your child better than you? No one. And so they would like to be treated as the experts of who's the most knowledgeable of what their child needs. They want for professionals to encourage them that they're doing a good job, even if there's places where improvements could be made or there's opportunities to improve. They really want to be told that they're doing a good job. Every parent is doing the best that they can, and that looks different in different circumstances, but they really want that encouragement. Communicating the results of the screening and reason for referral in a way that's clear and easy to understand. Clearly explaining when there's a problem. You can see the theme of clarity. There was a lot of lack of clarity from the parent's perspective, and they want to know when there's a problem. They want to know what that problem is in a clear way, and they want to know why a referral is needed. They also want for you to avoid using language that will scare them while still being clear. That's likely not as much of an issue for this group who's using plain language, but for providers who are speaking to them in acronyms or medical terminology that's not clear, that raises hesitation and makes it so that families are maybe not as willing to take their child for a follow-up evaluation. And then communicate whenever possible if referrals will have wait times so that families know what to expect and aren't thinking, oh, I'm going to get in with someone next week, but actually they've got like a 2-month wait time to get in for a referral. They said that's really helpful when they know that ahead of time. So recommendations, and I'll give you some examples of the referral toolkit in case it's something that you have not seen before. Recommendations for this group specifically is when we asked the family about their feedback for the referral toolkit overall, they said that they really loved it. They liked the way it was laid out. They liked the information that was included. They felt like it was helpful, and they felt like early child care providers were utilizing this toolkit when interacting with them because they found that their preschools and schools were communicating in a similar way of what's outlined in the toolkit. So that is really great. They wished that their providers' offices would also use the toolkit. They felt like their care with providers would be better if they were using the toolkit. So my recommendation to you all is to continue to utilize the Boulder County ABCD Partnership Referral Toolkit to educate staff, as well as to educate families served by your programs, and then to disseminate the toolkit in newsletters or whatever avenues you're using to communicate with families, because they really liked this content. A few examples in the link is actually on multiple pages. You can see on this slide here, there's the link. There's a references page where there's a link. But some of the pages that they liked specifically were the tips for talking to parents. So this just kind of gives an overview of how to communicate with families about the need for a referral, or even talking to a family about a potential developmental delay. They liked how, again, starting with a positive first, asking for the parent feedback, right? That goes back to valuing them as the experts of their children, making a recommendation that's clear so they understand what you're saying, and then emphasize the importance of earlier being better, right? Oftentimes delays can be corrected quickly and easily with some simple interventions. However, the longer they progress, sometimes the more challenging it can be to correct those, and it can definitely have an impact on their learning and overall well-being. The other one they really liked was hard conversations and what do I say? So here's just some kind of tips on having hard conversations with families. Sometimes providers and professionals had previously identified that it was hard to talk with families about their child having a developmental delay or an abnormal developmental screening. And so here are just some tips on how to have hard conversations with family members, and they really loved this one. Another item in the toolkit is cultural and relationship considerations, just how to be considerate of other cultures and, explaining some of the American culture that families may or may not be familiar with. One thing that I didn't mention that was a takeaway from the focus group is sometimes Latino and Spanish-speaking families may be interpreted or have the reputation of being hesitant to have a developmental evaluation or intervention as a result of a screening because of family members from older generations saying, oh, your sibling didn't talk until they were 4 and they're fine, or whatever it is. But there was a lot of mixed feedback on that. Some families said that, yes, that's true for my family, but most parents said that they were very open and willing to have a developmental evaluation, a developmental screening, and they really wanted that for their children because they wanted whatever resources were available to help their kiddos succeed. They were very interested in that. They just, again, wanted it to be clear. So I think that was just a good reminder is that every individual is different, and just meeting them where they're at when it comes to maybe what their barriers or questions are around a developmental evaluation.
Maybe Laura, I might interrupt you here, and can you
Yeah.
put some of these links in the chat? And I think we might jump
Yes.
to see Ning with communicable
Yep.
diseases. Is that okay?
Absolutely.
But
Done.
thank
Yes.
you, and wonderful
Yes.
research. And it shows ECE directors and staff, you are the go-to person. So take that as a compliment that you've really instilled confidence in your children and families. So thank you. Okay, I'm gonna jump to share my screen. Oops. Oops. Okay, so
Perfect. Thanks, Martha.
yep.
For the sake of time, we are going to skip over a few of the things we were going to talk about. Maybe we'll bring them back in our next presentation, so come to the next one in August, I believe, and Martha will talk about that later. But I'm going to chat a little bit about what's going on in communicable disease today. So I am sure that a few of you living in Boulder may have heard of an increase in pertussis in Boulder County. We are seeing an increase in specifically, Martha, can you change things perfectly? Perfect. We are seeing cases predominantly among school-aged children in Boulder County at this point. Just for some context, we've seen 22 cases reported from January 1st through May 10th. So May 10th was last Friday. I will say that we have had a few more cases reported since then. Just to give you some context on that, though, post-pandemic, the average was about 7 cases a year. So you can see that we are looking higher than last year for sure, but compared to our pre-pandemic average from 2014 to 2019, we did have 60 cases a year. So it's not an outrageous amount of cases. It's not a situation where we're worried about anything. It's just likely having to do with providers not thinking about pertussis when people are coming in with respiratory symptoms. And so now that we're coming into this kind of post-pandemic era, we are seeing more providers test for pertussis and therefore more cases. Perfect. Thanks, Martha. Just to give you some reasons why we care about pertussis and what to do about them in ECEs. So particularly in infants, pertussis can present as a more severe illness, and actually half of infected infants are hospitalized. Young infants might their symptoms might present a little bit differently than an adult, whereas adults will have kind of that uncontrollable cough with the whooping, kind of like a barking cough. Young infants might just have some gasping and inability to breathe, or their skin may turn blue. So just some symptoms to potentially look out for in your ECEs. Like I said, we are mainly seeing cases in school-age children right now, not necessarily infants or toddlers, but as we all know, infants and toddlers do tend to have siblings that attend school. So there might be some cases that we see pop up in ECEs as well. But what do you do? So like I said, we want to be keeping an eye out for pertussis-like symptoms. So anything that might look a little bit different than normal respiratory symptoms, like I said, that gasping, inability to breathe, or their skin turning blue from a lack of oxygen. If you have any reason to suspect pertussis in an infant or a toddler, or any of your preschoolers as well, definitely immediately exclude them and have them referred to a healthcare provider. Our exclusion criteria right now is returning after 5 days of appropriate antibiotic treatment or until 21 days after the onset of cough, whichever is first. So obviously it's pretty important to get the antibiotic treatment because you wouldn't really want to exclude someone for 21 days or more.
And you know what? With measles, since we still have our partners to present, we will present on measles in August. So I apologize.
Perfect.
Okay, so go ahead and get your calendars out. And you'll see these in the slides too. If you want to do any trainings for your program, you can contact Kyla or Tori, who will do wonderful trainings for your program. Our next Health ECE partner meeting is Monday, August 12th from 12 to 1. And I know we have some people from ECC and CCAP on the line. If you want to give any updates, go ahead, Amy. Might have to unmute yourself,
Okay.
Amy. Thank
Oh,
you.
hi. Can you hear me?
Yep, perfect.
Okay, thank you. I just have a few updates to share. We have ECCBC is hosting a couple professional development opportunities. I'm going to try to get those into chat. One is another early childhood teacher clinic, and that's in partnership with our Boulder County Public Health here today too, and it'll be a 4-session series, one of which will be the first one in person on Saturday. I believe it's June 1st at the ECCBC training space. We're going to be doing a Flip It training and then some follow-up trainings on Wednesday evenings throughout June, but the flyer is in the chat, so you can pass that on if you have any new educators who may be interested in this introductory ECE clinic. Then we also have a touch points coming up in June. That will be on June 4th, 5th, and 7th. And I'll put the flyer in the chat for that. It will be virtual. And we hope that some of you can join us for that. The next update is we have, if you're interested in borrowing vision or hearing screeners, ECCBC has those available to borrow. You just need to sign up to take, oh, awesome, you have it on the slide. Thank you. To sign up for a training session to learn how to use the screener, you can email Mary Lynn Nyman, and her email is there on the slide. So please feel free to do that. And then ECCBC we are holding adaptive equipment kits from Project Include. And so if that is something you're interested in, you can participate in the Project Include trainings, and they're on UC Denver's website. So you go through that training with them, and then you can borrow the adaptive kits. There's 5 different kits focusing on different areas to support development. And you can click there to learn about the Project Include. And then finally, I just wanted to share that May 18th, I think, is this Saturday. And some of you may have received an email from Casey Hedrick, our CEO, but we're having our inaugural March for Childcare event at Roosevelt Park in Longmont on Saturday. And this is a march to raise awareness and advocate for comprehensive childcare solutions that meet the needs of all families. So hopefully you received more information about that in your inboxes today. And I can also share that here in the chat. There's a lot going on, and I know we're about at time, so that's it.
Thank you, Amy. And Jody, would you like to share something from?
Sure. Yes, I'll just use my East Coast Fast Talk since we're at time and let you all know that unfortunately there is no huge update about the freeze for CCAP. So we're still waiting for state partners to come together and get, hopefully be off of the freeze and onto a wait list where we can prioritize some enrollments, but nothing is expected for the next 3 months, not even a timeline. So it's unfortunate, but that's where we're at. We are happy about some new providers. So thanks for new providers who have signed up for CCAP, because current families can still change providers. If you have any questions, feel free to reach out to me. I know we're at time, so thank you all.
Thank you, Jody. And you can put your email address in the chat if you want, Jody.
Yes.
Okay. One more thing, Monday, May 20th, emergency response training. Jane will send out an invite. And then if any of you on the call would like to receive professional development, please email us with your first and last name and facility at healthyce@bouldercounty.gov, and I'll send out personalized continuing education for listening for the last hour. And just thank you so much for all you do to keep our classrooms open, provide healthy space for children and teachers to learn and thrive. So thank you so much, everyone. I'll stay on the call a little bit longer if anybody has any more questions. But thank you again. And Jane will send out the recording and the slides later in the week. Okay, bye everyone. Thank you.
Thank you.
Thank you, Nina.
Is it just reply to the link address for the credit for the class?
Yes, I can even put it exactly. You just type that to healthece@bouldercounty.gov, and then you'll be emailing me. And so I'll send out the professional development certificate. Does that make sense?
Yes, thank you.
Okay, thanks for asking.